Have you ever wondered if the tests you keep asking for are actually doing more harm than good? It may sound unbelievable, but some of the health tests we once trusted may now be leading us astray. In fact, there are some medical tests that not only become unnecessary, but also potentially harmful after a certain age. This doesn't mean giving up on your health. Quite the opposite. It means learning how to protect yourself not only from disease, but also from overdiagnosis, fear-based decision-making, and unnecessary procedures that can silently rob you of your peace of mind, your independence, and sometimes even your life. In this video, we'll talk about 5 specific health tests that many seniors are still forced to undergo, despite growing evidence that they can do more harm than good after age 70. These aren't random guesses or conspiracy theories. These are patterns identified by experienced physicians, studies from major medical organizations, and even stories from seniors who have experienced the stress of being overestimated. Now, let's get started. First, the PSA test for prostate cancer after age 70. One of the most commonly ordered tests for men over 50 is the PSA test, a simple blood test designed to detect prostate cancer early. For many, it's a routine part of annual checkups, a reliable number on a test report. But as men age past 70, continuing to get this test without careful consideration can lead to more harm than good. The problem isn't the test itself, but what happens afterward and how it can trap seniors in a cycle of unnecessary procedures and side effects. The PSA test measures prostate-specific antigen, a protein produced by the prostate gland. Elevated PSA levels can indicate prostate cancer, but they can also be caused by benign conditions such as inflammation or an enlarged prostate. The test is notorious for producing false positives, meaning many men receive alarming results that do not actually reflect a dangerous cancer. This leads to follow-up biopsies, which carry the risk of infection and bleeding, and sometimes to treatments such as surgery or radiation that can cause urinary incontinence and erectile dysfunction. For men over 70, many prostate cancers grow so slowly that they never cause symptoms or shorten life expectancy. Detection of these cancers often leads to overtreatment, which reduces quality of life without providing any real benefit. Studies have shown that PSA screening in older men can increase anxiety and medical complications without reducing prostate cancer deaths. Consider the story of James, a 74-year-old retired teacher who had been getting annual PSA tests for years. When his PSA levels spiked, he underwent a biopsy and discovered a low-risk tumor. Faced with treatment options, James opted for surgery. Although the tumor was successfully removed, he spent months dealing with urinary incontinence and the loss of intimacy with his wife. His quality of life suffered, and he wondered if the treatment was worth it. Current medical guidelines recommend that men over 70 have a thorough discussion with their doctors about the benefits and risks of PSA screening. Many experts advise against routine PSA testing in this age group unless symptoms are present. Instead, a personalized approach that takes into account the patient's overall health, life expectancy, and values is needed. The goal is to avoid harm from unnecessary testing and treatment, and instead focus on comfort and well-being. So, if you're over 70 or caring for an elderly person, remember that more testing isn't always better. PSA testing can cause more anxiety and harm than comfort. Sometimes the best thing you can do is have a thoughtful conversation, not a needle or a test result. Protect yourself by asking your doctor if a PSA test is really necessary for your condition, because sometimes saying no is the smartest choice. It's not about neglecting your health. The point is to choose wisely, because after 70, the most important thing is to live well, not just live longer. Second, get a colonoscopy after 75. For decades, colonoscopies have been considered the gold standard for early detection of colon cancer, and for good reason. When done at the right time, they can save lives by catching dangerous polyps before they turn malignant. But after 75, especially in people with a normal screening history, the benefits of regular colonoscopies begin to wane and the risks begin to increase significantly. Colonoscopy is not only an invasive procedure, it requires bowel preparation anesthesia, and the passage of a flexible tube through the entire colon. For older people, the procedure carries more risks: bleeding, bowel perforation, side effects from sedation, and even hospitalization. While the risk of colon cancer increases with age, complications from surgery also become more dangerous as your body's ability to heal decreases. Many older adults are unaware of this delicate balance. They assume that more testing is always safer, but the reality is that a colonoscopy after age 75 can sometimes do more harm than good, especially if you have other health problems or are frail. For many people, the chance of finding a slow-growing cyst that won't affect their life expectancy is high, but the risk of complications from the test is also higher. Consider Margaret, an 80-year-old grandmother who has been following a 5-year colonoscopy schedule. Her most recent test was negative, but her doctor recommended that she get screened again just to be safe. During the procedure, a small tear occurred in the wall of her colon, which resulted in her being hospitalized and spending weeks recovering. The lesion did not cause cancer, but it did cause pain, fear, and loss of independence. Margaret's quality of life was affected not by the cancer, but by the test that was supposed to protect her. Because of these risks, many health organizations recommend stopping routine colonoscopy screening at age 75, especially for people who are other. No one wants to gamble with their health, but sometimes the safest option is to say no to unnecessary testing. After age 75, your health priorities shift from aggressive screening to protecting your quality of life. That means choosing tests that help you without putting you at unnecessary risk, and being thoughtful about when and why you do them. It's not about fear, it's about knowledge. It's about respecting your body's changing needs and making decisions that are consistent with both your past health and your future comfort. Because your years after 70 are precious, and how you care for yourself should reflect that. If you're still watching this video and you find this information helpful, please comment number 2 below to let me know you're here. And if you haven't already, I encourage you to subscribe and turn on the bell so you don't miss any videos. Your support helps us continue to create content that is helpful, informative, and inspiring. Now, let's move on. Third, asymptomatic full-body CT scans. In today's high-tech medical world, it's easy to believe that more imaging is better. More images, more data, more peace of mind. Whole-body CT scans promise to detect disease early, sometimes even before symptoms appear. But for people over 70, routine full-body CT scans without symptoms can be a double-edged sword, often doing more harm than good. These scans expose your body to a significant amount of radiation, much more than a standard X-ray. Over time, this radiation can increase your risk of developing cancer. Ironically, the very condition these scans are designed to detect is early detection. But the bigger problem is incidental findings, spots, nodules, or shadows that appear unexpectedly on scans but are either harmless or slow-growing. When a doctor finds something that is not obvious, it often leads to a series of follow-up tests, biopsies, or treatments that may carry serious risks or cause anxiety with no clear benefit. For many older adults, the likelihood of such incidental findings is high simply due to the natural changes that come with aging. This can lead to what is known as overdiagnosis, finding and treating conditions that never cause harm. The emotional toll alone, the constant anxiety, the hospital visits, the invasive procedures is enormous. And that's before considering the physical toll of complications. Take Martha, an active 76-year-old woman who underwent a whole-body CT scan for a routine checkup. The scan revealed a small nodule in her lung. Despite reassurance that it was likely benign, her doctors recommended a biopsy. The procedure led to complications, including bleeding and hospitalization. Martha spent weeks recovering and became more anxious than ever. The nodule never turned out to be cancerous. The whole-body CT scan led her to unnecessary procedures. Health experts increasingly warn against using whole-body CT scans in otherwise healthy older adults without specific symptoms or risk factors. Instead, screening should be targeted and individualized, focusing on tests with proven benefits and acceptable risks. This approach avoids the emotional and physical harm of chasing something that may never turn out to be a disease. If you are over 70 and considering a full-body CT scan, ask yourself and your doctor, what am I looking for? How will this change my treatment? What are the risks? Sometimes the best answer is to monitor your symptoms and keep seeing your doctor regularly rather than getting every CT scan possible. Fourth, get an annual chest X-ray to screen for lung cancer and non-smokers. Many older adults, especially those who have never smoked, are often advised to get an annual chest X-ray as a preventative measure against lung cancer. It makes sense. Catch cancer early, treat it early, save lives. But for people over 70 who do not have a history of smoking or significant lung disease, routine chest X-rays often do more harm than good. Chest X-rays are a limited tool for detecting lung cancer, especially in people who do not have symptoms. They can miss early-stage cancers and often detect harmless abnormalities that lead to a series of unnecessary follow-up tests. These follow-up tests may include CT scans, biopsies, or even surgery, each of which carries the risk of radiation exposure, infection, and complications from invasive procedures. For many non-smokers, benign lung nodules or scars from previous infections are common and harmless. However, when an X-ray reveals these incidental findings, they can trigger a series of anxiety, invasive tests, and public treatments that reduce quality of life. The psychological impact of false. After one such scan revealed a small shadow, she was referred for multiple scans and biopsies, which caused pain and complications. Ultimately, the shadow was found to be benign. However, the emotional and physical discomfort she experienced was real and lasting. Leading health authorities now recommend against routine chest X-rays for lung cancer screening in low-risk older adults. Instead, they recommend targeted screening for high-risk individuals, primarily long-term smokers or those with a history of exposure to environmental hazards. For most older adults who do not fall into this category, routine chest X-rays offer little benefit and carry a significant risk of harm. This is an important distinction. Screening is not about avoiding necessary care. It is about avoiding unnecessary harm. When it comes to lung cancer screening, more is not always better. The best approach is individualized care, balancing the risks and benefits based on your specific health history. Before agreeing to a routine chest X-ray, ask your doctor, how likely is this test to benefit me? What are the risks? Are there less invasive or safer alternatives? Being informed will help you avoid unnecessary procedures that could compromise your peace and health. Protecting your health after age 70 means making informed choices about which tests are truly necessary and which can be safely avoided. If you're still watching this video and found this information helpful, please comment number 4 below to let me know you're here. And if you haven't already, I encourage you to subscribe and turn on the bell so you don't miss any videos. Your support helps us continue to create content that is helpful, informative, and inspiring. Now, let's move on. Fifth, routine cognitive testing without symptoms. Many older adults find themselves facing a battery of cognitive tests during doctor visits, even when they have no real signs of dementia or confusion. While screening for dementia and cognitive decline is important when symptoms arise, routine cognitive testing without any warning signs can lead to unnecessary fear, stigma, and sometimes even misdiagnosis. For people over 70, this overestimation can do more harm than good. Cognitive tests are designed to detect early signs of diseases like Alzheimer's. However, in the absence of symptoms or noticeable changes in daily functioning, these tests often detect normal changes in memory and thinking. Aging naturally comes with slowing down of processing speed and sometimes forgetfulness. When these normal changes are perceived as decline, older adults may feel depressed or anxious about their mental health, even if no serious problems exist. The emotional impact can be profound. Imagine being told you may be on the path to dementia based on a screening test without any real evidence of decline. This can lead to increased stress, depression, and social withdrawal. Ironically, these factors contribute to cognitive difficulties over time. Furthermore, without effective treatments for early cognitive decline, the benefits of widespread screening and asymptomatic older adults are limited. Take Sarah, a 75-year-old retiree. Nurse Sarah went in for a routine physical and was asked to undergo a series of cognitive tests to be safe. The results showed mild memory impairment, which her doctor explained carefully. However, Sarah left feeling anxious and confused, doubting each memory lapse. Her anxiety grew, and she became reluctant to participate in the social activities she once enjoyed. A few months later, a specialist reassured her that her test results were within normal limits for her age, and that her memory changes were due to typical aging, not disease. But the stress she experienced in the interim was real. Experts now recommend that cognitive testing be reserved for older adults who show signs of memory loss, confusion, or difficulty with daily activities. For healthy, asymptomatic older adults, routine cognitive screenings may do more harm than good. Instead, maintaining a healthy lifestyle, staying socially active, controlling cardiovascular risk factors, and engaging in mentally stimulating activities remain the best ways to protect brain health. It's important to remember that brains age differently. Some people remain sharp mentally well into their 90s without formal testing. Others may experience gradual decline that doesn't fit the typical pattern. Personal care and monitoring for signs are more important than general testing. So if you're over 70 and feeling healthy, don't let routine cognitive testing shake your confidence or shape your future. Instead, focus on what really supports your brain and your health: connection, nutrition, physical activity, and fun. Remember, not every test is a health tool. Some tests, if done without a clear reason, can cause more anxiety than help. Protect yourself by understanding when to get tested and when to avoid them. Final thoughts as we wrap up this important conversation: remember that aging is a unique journey for each of us. Tests and screenings that were once considered essential may change in value as we age. The most important thing after 70 is to protect your peace of mind and focus on quality of life rather than chasing every possible health scare. Making informed choices about which medical tests to get and which to avoid is a powerful way to take control of your health and well-being. This doesn't mean neglecting your self-care. It means making thoughtful, personalized decisions that respect your body and your future. Think about your own health journey. Are you getting tests because they really help you, or are they just routine? It's okay to ask questions, seek second opinions, and prioritize your comfort and well-being over unnecessary procedures. Your time and energy are precious, and the best gift you can give yourself is a balanced approach that supports your vitality without adding stress or harm. Thank you for your trust and interest in us today. We'd love to hear from you. Leave a comment below about an insight you found helpful and how you plan to apply it in your life. Your experiences and perspectives matter to us, and sharing them helps build a caring community